Anticoagulants. Anticoagulants means in the name itself is there. Anti means opposite, against, coagulants. So these are the drugs will act against the coagulation. Let me discuss about contents, definition, classification, mechanism of action, pharmacological action, pharmacokinetics, adverse effects, contraindications, and uses. Let me go with the definitions. Anticoagulants are drugs that prevent or reduce the formation of blood clots by interfering with the blood clotting mechanisms. So, in a very simple word, during any injuries, what will happen? The blood vessel will be broken, and whatever the blood will be there, so it will be ooze out. So bleeding will happen. So the platelets present in a blood, it will form a clot. The platelet action is that only formation of clot. So these anticoagulants are used to reduce the formation of clot. So these anticoagulants play a crucial role in the prevention and management of these thromboembolic diseases or disorders. So that means these anticoagulants are not only used after formation of clot, this also used as a prevention purpose, means prophylactic purpose to reduce the clot. So here it is mentioned thromboembolic disorders. Thromboembolic disorders means the clots, what are the clots will form, so that clots will broken and it will be travel through the blood vessels in the bloodstream. So those diseases we call as a thromboembolic disorders. So by inhibiting the various factors involved in a coagulation cascade, anticoagulant drugs help to maintain the normal blood flow and are widely used in medical practice for both the treatment and prevention of clot related diseases. Means by inhibiting the coagulation factors and activating the natural anticoagulant mechanism, these anticoagulants reduces or prolong the coagulation. Let me discuss about the classification. These anticoagulants are classified into two types, in vivo and in vitro. The very first class will be in vivo. This in vivo is again subclassified into two types. The first one is parenteral anticoagulants and second one is oral anticoagulants. Parenteral anticoagulants, example heparin, low molecular weight heparin. Second class will be oral anticoagulants. Oral anticoagulants are again subclassified into two types, coumarin derivatives and indendione derivatives. Example for coumarin derivatives are warfarin sodium, acinocoumaril. Example for indendione derivative is phenindione. The second main class of anticoagulant is in vitro anticoagulants. So these in vitro anticoagulants, again heparin will come because heparin is used in vivo also, in vitro also. The second class will be calcium complexing agents. Example sodium citrate, sodium oxalate and sodium editate. So let me discuss about the heparin in this video. So the remaining drugs we'll discuss in the next video. Heparin, so you know well that heparin is a very effective anticoagulant drug. So this heparin is used as a in vitro, in vivo both. So let me see how this heparin will reduces the coagulation. So this heparin after administration activates the antithrombin 3. So this antithrombin 3 is a naturally occurring anticoagulant substances, means in a blood, for example everything is there in our body naturally. So if for example if we have a fever because of body pain, if we relax, so automatically the fever also will reduces, body pain will be reduces. So our body itself have a natural healing power. So when bleeding is happening, so how clot will form, so like that in the natural way the clot also will get dissolved or break down by antithrombin 3 is a plasma protein. So this antithrombin 3, by inhibiting the coagulation factors, it reduces the coagulation. Let me see how. So this heparin activates the antithrombin 3, and this antithrombin 3 is a naturally occurring plasma protein and it reduces the coagulation. How? By inhibiting the coagulation factors 9A, 10A and prothrombin. So this coagulation factors 9A, 10A we know because there are total 14 blood coagulation factors. In that 9A, 10A will come. Then what it is? Prothrombin. So this prothrombin also a protein. So usually it helps to activation of the thrombin. So due to inhibition of this prothrombin leads the inactivation of thrombin and also coagulation factors 9 and 10. So these coagulation factors and thrombin, especially thrombin, helps to formation of fibrinogen into fibrin. So fibrin is a thread-like formation. The last step of coagulation is a formation of fibrin, the thread-like structure. Because you know well that so in HAP and all we'll go with the clotting period. So when we'll find out the clotting time, we'll consider formation of thread-like structure. So if thread is formation while using the capillary tube, where if we are breaking every 30 seconds the capillary tube, we'll consider when thread will form. So that we consider as a clotting time. So here also this thrombin helps to formation of that thread-like structure fibrin from fibrinogen to fibrin, so that it reduces the clotting or it prolongs the clotting time. So this heparin activates the antithrombin 3. So this antithrombin 3 inhibits the coagulation factors 9A, 10A and prothrombin. This leads inactivation of thrombin 9 and 10. So due to inactivation of thrombin, there is no formation of thread-like structure, so that it prolongs the clotting. This is about the mechanism of action. If you come for pharmacological action, so this heparin has three pharmacological actions like anticoagulant action, antiplatelet action, and lipemia clearing. Anticoagulant action means just now we discussed in the mechanism of action. So by activating the antithrombin 3, it inhibits the coagulation factors and it prolongs the formation of clot, so that it shows the anticoagulant action. Next is antiplatelet action. So this heparin will reduces the or it suppresses the platelet action, so that it has an antiplatelet action. The next one will be lipemia clearing. Lipemia clearing means the free fatty acids present in the blood. So in the plasma, it looks like a turbid. So this heparin will clears the free fatty acids, so that the plasma will looks clear. That's why it is called as a lipemia clearing. So next will be pharmacokinetics. So this heparin, you know well that it is given in vivo. Orally means we won't prefer because we'll go with the parenteral route and in vitro. So why we not given orally? Because it doesn't have any action, or it is not effective if we given orally. So that we used to prefer the intravenous and subcutaneous, but we should not go with the intramuscular because it form a hematomas, the clot formation, and it is widely distributed throughout the body, and 70 to 90% of the drug will bound the plasma proteins. So due to 70 to 90% of the drug bound the plasma proteins, so this bound plasma proteins acts as a reservoir, so that we can achieve the longer duration of the action. It is metabolized in the liver by the enzyme heparinase and excreted through urine. Adverse effects. So what are the adverse effects caused by heparin? Means bleeding. So how it will cause bleeding? Because it has the anticoagulant action. Bleeding it won't observe in all the cases if the person have bleeding disorders like hemophilia. So for them, due to clotting factors deficiency is very difficult to formation of clot. So once bleeding start means it will be continued. There is a loss of more blood. So if in that case, if the person have bleeding disorders, for them if you administered heparin, there is a chances of excessive bleeding. This is the side effect. Then second one is hypersensitivity reactions. So why these heparin will cause hypersensitivity reactions? Because it acts on the immunity. So it will cause or it will alters the immune mediated responses, so that it cause hypersensitivity reactions like rashes, and it causes thrombocytopenia because it has an antiplatelet action, so that it reduces the platelet count also. So the low count of platelets we called as a thrombocytopenia. Next will be alopecia. So alopecia means the loss of hair in a particular place. You can see in the image. Here in this image, there is a small portion of the head will looks like baldness. So there is a loss of hair. Why it will be means it will affect the hair follicles, so that it cause the alopecia or baldness. Next will be osteoporosis. So why this heparin will cause the osteoporosis? Because it suppress the bone growth. So due to that, there is a resorption of the calcium and iron. There is no absorption of the calcium and iron. It makes bones will be weak, and it forms slowly pores. So that we called as a osteoporosis. Contraindications. Contraindications means heparin is an anticoagulant action, and these when we should avoid this heparin, that we call as a contraindications, when we should take a precautions to administer a heparin. So we should not given in case of bleeding disorder. If the person have a bleeding disorder, we should not give a heparin because it causes a excessive bleeding, because this has an anticoagulant action. And also we should avoid in case of severe hypertension. So why means in case of severe hypertension, there is a more blood pressure. There is a due to increase in a blood pressure, there is a chances of rupturing of the blood vessels. So in the severe hypertension, due to high blood pressure or high pumping, so the blood vessels have a pressure, and it may have a chances of rupturing of the blood vessels. So in that condition, if you given heparin, so it may causes the internal bleeding or excessive bleeding. So that to avoid that, we should avoid in case of severe hypertension. And also in case of chronic alcoholics. So why we should avoid chronic alcoholics means, in the chronic alcoholics, there is a possibilities of the damage of the liver. If liver damage will happen means, usually the coagulation factors 9 and 10 will be synthesized or released from the liver. So this heparin will act on the coagulation factors 9 and 10. So if liver is not working properly, that coagulation factors are not released, and this also will, what are the coagulation factor released, that also it will affect. So there is a possibilities of excessive bleeding, so that we should avoid in case of chronic alcoholics. And next, at last, we should last contraindications will be aspirin and other platelet drugs. So why we should avoid in aspirin means, aspirin is an antiplatelet drug. So this also used in the clotting disorders only. So this aspirin will inhibits the platelet. This heparin also has an antiplatelet action. So there is a possibilities of increase in excessive bleeding. So that we should avoid in case of aspirin. So when we should avoid as heparin means, in case of bleeding disorders, severe hypertension, chronic alcoholics, and aspirin and other platelet drugs. Uses. So in which conditions we'll use the heparin means, we used heparin in case of venous thrombosis, means formation of clot in a blood vessels. So in that condition we'll use. And also it is used in a pulmonary embolism, means formation of clots in a lungs. So in a pulmonary embolism condition we'll use. And also it is used in a unstable angina, means you know well that unstable angina means there is a formation of clots in the arteries. To reduce that clot formation, we'll use the heparin. And also in case of dialysis, so during dialysis, you know well that to purify the blood, one side the blood will be going for the purification, and another side the purified blood is entering the body. So during that process, to avoid the formation of clot, we'll use the heparin as a prophylactic purpose. And also it is used in case of myocardial infarction. So myocardial infarction means there is a formation of clot. Here also we'll use the heparin to reduce the clot formation. Thank you.